Hi, everyone. Welcome. I'm going to wait just a minute for folks to come in, join the webinar. Recording again, Liliana. Okay. So hi, everyone. Thank you so much for joining us today. My name is Rohini Singh, and I'm the Assistant Director of the School Justice Project at Advocates for Children of New York. Today, we're going to be discussing accessing behavioral health supports in schools. Just some logistical notes. Everyone will get a copy of this PowerPoint presentation after the presentation is over. You'll get an email with additional information and a copy of the PowerPoint. I'm also going to wait to answer specific questions until specific points in the presentation, but feel free to use the Q&A feature. That's an option on within Zoom during the presentation as questions come up. Don't use the chat function. I won't be monitoring, and I don't think you're able to use the chat function, but you can use the Q&A feature to ask specific questions. We have another AFC staff member who will be monitoring the Q&A and can either answer your question directly or flag it for me to discuss at the Q&A portions of the PowerPoint. Just another note about questions, this presentation will be recorded, and so it's currently being recorded, and so and it'll be put up on our YouTube channel afterwards so that other people can view it. So if you have specific questions about your child's circumstances and would rather not have them discussed in the recorded segment, we will leave just a few minutes at the very end to stop recording and answer any of those questions. Again, you will receive a copy of the PowerPoint after the presentation is completed. And at the end of the presentation, we will have a short survey for you to fill out. And so please fill it out once you're prompted to do so at the end. So as we are waiting for everyone to join us, let's maybe launch a few opening questions. So first, we have just an attendee intro poll. You could fill this out for us so we can just get a little bit more information and see who's here and where you all are from. Great, and I can't actually see the results, but, oh, here we go. So yeah, so we have a good group of people here. Looks like all of the boroughs are represented, which is great, great to see. And some students are joining us, which is wonderful, parents, educators, and professionals. Great, so let's launch the next two polls. Just some demographic information, which is helpful for us to gather and something that we need to report to some of our funders. Okay, I don't know if we can move on to now the final poll. And this is the federal disability categories. So for us to get a sense of if any of the following federal disability categories apply to your child or children, and please select all that apply. Okay. Well, thank you everyone for filling those out. That's helpful information for us to have. So now we will move forward and launch into today's training. So today, just an overview of what we'll be doing. I'll give an introduction on Advocates for Children, who we are and what we do. I'll give an overview, about why this issue is so important, why behavior supports are so important, especially in this time. I'll talk about supports that are available to all students, specific supports for students with disabilities, some tips, advocacy tips and strategies, and then, or some tips and strategies when it comes to effective behavioral supports for students, and then finally, advocacy tips and strategies and problem solving when you're trying to access these behavior supports in school. So first, what is Advocates for Children? So AFC is an independent agency that protects the education rights of all New York City students. We were founded over 50 years ago now by parents of students with disabilities, and our mission has expanded over the years. We have a number of different projects. We have an early childhood education project, a project that works with students in charter schools, students in temporary housing, immigrant students. We have the School Justice Project, a project that works with children in foster care, and a project that works with overage and older students who are transitioning out of the school system. We have a number of services. We have a citywide education helpline that you or anyone can call and get information on any education-related issue in New York City. We also have a number of guides and resources on our website, and I'll try to mention some of the key guides and resources that could be helpful for you when you're advocating for behavior supports. But I do encourage you to go on our website and look through some of those guides. We do free workshops and trainings like this webinar today for community members, for families, for schools, students. And the bulk of our services are free legal services for low-income families. So first, let's turn to discussing the need and the definitions of social, emotional, and behavior supports. So social emotional learning is the process through which all people acquire and apply the knowledge, skills, and attitudes to develop healthy identities, manage emotions, and achieve personal or collective goals, feel and show empathy for others, establish and maintain supportive relationships, and make responsible and caring decisions. It's important to note, and I'll emphasize this a few times during the presentation, that schools are not just responsible for providing students with spaces for academic learning, but also for social emotional learning and development. Our social emotional learning, or emotional and social well-being, it affects how we think, feel, act, and it helps demonstrate how we handle stress, relate to others, and make healthy choices. And so since these are all necessary skills for life, these are also necessary skills for schools to be teaching children and for students to be learning. And so, this might be very obvious since you're here today for this presentation, but some of this is helpful context and helpful grounding, especially as we advocate for either our children or students that we're working with. And we're speaking to the DOE and school staff about, the need for behavior supports. It's really important to be able to emphasize and say that, unmet social, emotional, and mental health needs can have a significant impact on learning. And so, this is our current climate and our current reality is really important to think about as we try to advocate for more supports for students. We know this from our lived experience, but it's important to acknowledge that as we start, that our children are experiencing separation from support systems, disruptions in routines, increased rates of depression and anxiety, compounded grief and trauma from COVID-19, and so on. We see this in our families, in our schools, our communities, and nationally in the headlines. These are just some of the headlines, but we know that there are more, and that the current and long-term impacts of the past 2 years are significant. And that's why we're here, to talk about behavior supports. And, it's important to think about and think through so that we remain grounded in sort of the urgency in advocating for these supports. And so specifically, when we talk about the impact of, stress and trauma on learning, stress and trauma and unmet mental health and behavioral health needs negatively impact a student's chance of success at school. And so when a child's housing or family life is unstable, there are many stressors competing for that child's attention and energy, and these feelings can quickly become overwhelming, especially to a younger student. And all of that competition for energy and attention can make a student less available to learn. And so when students are experiencing chronic stress and trauma, they are more at risk for failing academically, as well as exhibiting challenging behavior in school, such as aggression or extreme withdrawal and disassociation. And so when students are less available to learn, they're obviously more at risk for not succeeding in school. And so again, it's important to keep this in mind and think about the impact that unmet behavioral and mental health needs can have on learning. In addition to thinking through that portion of it, that we need to have these effective behavior supports in order for students to be in school and learning. We also want to keep in mind that parents have specific rights that they should be aware of when it comes to behavioral challenges, or when their students having behavioral challenges in school. And so first, the school should not ask you to keep your child at home, ask you repeatedly to pick your child up from school early, or ask you to remain in the classroom with your child because of their behavior. The school should not exclude your child from after-school activities or field trips because of their behavior. The school should not hold over your child. The school should not repeatedly complain to you about your child's behavior. The school should not repeatedly suspend your child due to their behavior challenges. In addition, the school should notify you if they use a physical or mechanical restraint on your child, or if a student is placed in a timeout room. The school should not request school safety agent or police assistance to manage your child's behavioral or mental health issues or to discipline your child. The school should not call 911 when your child has a behavioral or mental health challenge unless it is a true emergency. And the school should not refer a student to virtual learning because of their behavior in the classroom. So keeping in mind that parents do have rights in this process, and those are things that schools shouldn't be doing, let's turn now to talk about some of the supports that you can advocate for in lieu of and to prevent the school from engaging in the inappropriate behavior that I just described earlier. And so some school-based supports that are available to all students. And so these are universal supports within the DOE that even students without disabilities have access to. Some of them include at-risk counseling. So this is offered on a limited time basis, usually for 8 to 12 weeks for students who are struggling with specific circumstances. So they're not mandated, so they don't go on a student's IEP, individualized education program, or a 504 plan. And they're usually just provided as needed. And they could be with a school social worker, guidance counselor, psychologist, et cetera. There are also a number of informal behavior interventions that can be implemented by a teacher, guidance counselor, classroom paraprofessional, et cetera. And this could be for a limited time period. This could be something like a behavior contract or chart, a conduct card, attendance monitoring, a points or reward system, using a signal to take a break and see a school counselor, doing a check-in at the beginning or at the end of the school day. A bit later in the presentation, I'll be going over some very specific behavior interventions for specific populations. And these are all strategies that you can try to put in place and advocate for on an informal basis, outside of the special education process. A crisis de-escalation plan. So all schools are required under Chancellor's Regulation A411 to have a crisis de-escalation team that develops a plan each year. And that plan must include strategies for de-escalating behavioral crises, must identify locations in the school building where a student in crisis may be safely isolated from others. It must identify any school staff trained in de-escalation techniques. It must identify in-school and community resources available to the school and parents. And it describes how crisis de-escalation and response protocols are communicated to school staff. And you'll see if you look at Chancellor's Regulation A411, it really emphasizes that this crisis de-escalation plan must be followed prior to any call to EMS or 911 for a student that is experiencing a behavior crisis. And so if you are in a situation where your child's school is calling EMS or 911 repeatedly, we would recommend that you request a copy of the school's crisis de-escalation plan, and find out who the adults are in the building that are responsible for de-escalating students that are in crisis, and see if they are implementing that plan prior to calling 911 or EMS. In addition, Every school has some type of mental health supports for students. This will vary depending on the specific school, and I'll get into a little bit later how to identify what supports and services might be available within your specific school. But every school should have some type of support for students. This could be anything from having access to a mental health specialist to help train staff or provide assistance on individual cases, to having access to crisis intervention staff during school emergencies, to having potentially a mental health clinic on site at the school. In addition, some schools have students in temporary housing community coordinators or single shepherd success mentors who help support students. And as I mentioned in a few slides, we'll talk about how to find out what services are in your specific school. So just some examples of school-based mental health services. The city has a central crisis response team, or they used to be called school response clinicians. And these are licensed social workers who support students facing crises across the city to reduce the practice of staff calling 911 and reduce trips to emergency departments. They're available to assist schools when responding to students in emotional distress, as well as provide professional learning citywide for social workers, school counselors, and crisis teams. In addition, there are some schools, only about 28, that have access to something called the school response team. These teams provide crisis support and interventions, including assessments of individual students and recommended services, staff trainings, and mental health referrals for families and students. There's also a school mental health specialist program who work with, and these were formerly called mental health consultants. And these were for, these specialists work with a group of schools to provide mental health education to school staff to help them address students' mental health needs and strengthen community and family involvement in supporting students. There's also a school mental health prevention intervention program. This is only in 42 schools that helps schools assess the need for mental health services within their school building, partner with community providers, set up school-based programs, offer crisis supports and interventions. There are specific schools that have partnerships with health and hospitals clinics. This is also known as pathways to care. It's, I think, in about 35 schools. And essentially students can get diagnostic evaluations, ongoing therapy, medication management, and other clinical services, either done at the health and hospitals clinic or via telemental health. So a school or a parent can make a referral for children who's learning in one of these schools with this partnership. And it's essentially a fast track to mental health care at one of the partner health and hospitals clinics. There are also a number of community schools that have specialized mental health services. They partner with community-based mental health providers to offer counseling, trainings, interventions, and crisis support. There are a number of schools with that have a health center that will provide mental health services. There's about, I think, around 300 schools that have this, and this is typically a nurse practitioner or physician assistant, a social worker, and a mental health provider. And then finally, there are also schools that have mental health clinics. And I think right now there are about 190 schools. And this offers a full range of services for students, psychiatric evaluations, individual family group therapy, medication management, crisis intervention, and 24-hour crisis support. So for students, in order to figure out what support could be available at your specific school, each school has a DOE website that lists the specific mental health supports in each school. So if you go to schoolsearch.schools.nyc and type in the name of the school or address and any information that you have about the school, the borough that it's in, the grades that it serves, et cetera. And then you will be able to get to the school's homepage on the New York City DOE website. And then if you scroll down, there's a tab here that says mental health and wellness. And if you click on the tab, you'll be able to see the specific mental health supports that are available at that school. So for this school that I picked randomly, this school has a school-based mental health clinic, and they partner with New York Presbyterian Hospital. There's a number here that you can call to get access to that. It also mentions that they're a community school, that they have crisis and some other other additional supports, crisis supports, and then generalized information about the NYC hotline and Height site. And so this is just important to know, so that you can be aware of what resources exist within a particular school. Not all school staff are going to know, all about all of the supports that are available within their particular school. And so it's good to be able to look this up and find out. And so you can ask specifically, can I have access to this because my child needs more support? I also just want to mention briefly, because we do mention in the beginning, that schools should not be suspending students repeatedly for behavior, especially behavior that might be part of a student's disability. And even if the student hasn't been identified as a student with a disability, if they have behavioral challenges, behavioral needs that need support, there are ways to use the New York City Discipline Code to advocate for more supports for students. And so the Discipline Code contains a number of pages, and it's essentially the first 30 pages of the code talks about the ways in which the DOE is supposed to be approaching progressive discipline, and that the DOE embraces progressive discipline. And so it says within the Discipline Code that overly punitive methods of discipline are not in the best interest of students, that students are better served by providing positive supports that teach students social, emotional, and behavioral skills, that schools should be providing enhanced support to students with special needs or those suffering from trauma due to exposure to poverty or violence, and that New York City will reduce the use of suspensions as a disciplinary tool. Again, this is just a good way to hold the DOE accountable, hold schools accountable, using the language that they have within their own discipline code to your advantage when advocating for your clients is really important. I also want to mention that the Discipline Code highlights and emphasizes the use of restorative justice. So restorative justice practices under the new Discipline Code, all New York City elementary schools must provide social emotional learning to students, and all middle and high schools must implement restorative justice practices. And instead of blaming someone, a restorative approach asks what happened, who was harmed, what needs to be done to make things right, how can people behave differently? It takes into account all members of the school community, that they bring with them different abilities, interests, viewpoints, and family and cultural backgrounds. And so we often will advocate for the use of restorative practices in lieu of discipline for a situation where, a student, there are very few situations where discipline is necessary, but, especially for a situation where students, it would benefit the whole school community for a student to have an understanding of the harm that they cause, and have a safe space for participants to be able to express themselves and actively listen to each other. And so it's important to note that schools do not have to suspend students for most infractions in the Discipline Code. You can use the Discipline Code to advocate, against a suspension, to advocate for behavior to be considered with a lower level of an infraction, to advocate for the use of restorative justice practices in lieu of discipline. Again, these are supports that are available to all students, and that, again, as I mentioned, are contained within the Discipline Code. And then finally, in terms of supports that are available to all students, all schools should have some sort of social emotional learning curriculum. And this is something that was implemented upon the return to school after the school closures during COVID. And schools should be focused on building community and resilience. All staff at this point have been trained in trauma responsive educational practices. There's an emphasis on partnerships between school-based mental health clinics. And there's more information available on the DOE's website about the different social emotional learning curriculum that should be available within schools. Again, it emphasizes that schools should be providing all students with these supports, not just students that have IEPs or students with disabilities. So again, if your child or the student you're working with has not yet been identified as a student with a disability and does not have an IEP, they could and should still be receiving behavior supports in school. Great. So before we turn to talking more specifically about supports for students with disabilities, I just want to pause to see if there are any questions, and I do not see.
There are no open questions right now.
No open questions. Great. All right, so we will continue on. So now I'm going to be talking about behavior supports for students with disabilities. And so the remaining behavior supports are just for students with IEPs, although I should say that some of the strategies that I mentioned and some of the advocacy points that I'll mention towards the end could apply to all students. And so even if your student doesn't have an IEP, this is still helpful information to know. So I'm going to be focusing mostly on specific behavior supports that you can request if your child is experiencing behavioral challenges so that they can remain in their current school environment. But it's important to note, that your child might require a new school environment or a more appropriate school placement depending on their individual needs. And so if you feel as though your child's school is just unable to support your student's behavior, I would encourage you to watch one of our special education webinars or read our special education guide on our website so that you can have a better understanding of your rights when it comes to asking for a new placement for your child. I should say that in general, there are limited options for placements when it comes to students with behavioral needs. I'm sure many of you here are probably aware of this already. Often what we see, and I imagine many of you experience, is that students that are experiencing behavioral challenges are referred to New York City Department of Education Specialized School District, or District 75. While District 75 might be appropriate for some students, it's not necessarily going to be appropriate for every student. And we believe that schools should be providing more behavior supports in a District 1 through 32 setting so that students can remain in less restrictive environments. We know that the DOE is working on some programming to try to prevent the over-referral of students with behavioral challenges to District 75, but it certainly is a work in progress. And I will go through, and I'll talk a little bit about one of the new programs called the DOE PATH program for young students who are experiencing behavior needs that is available in just a few schools, in a few districts right now. I also want to note before we move on that it's important to know that all students with IEPs, no matter what their classification is, are entitled to behavior supports. And so we also see, and you might also experience, that some students or families are told that the student's classification must be changed to emotional disability, which is the classification formerly known as emotional disturbance, in order to receive certain supports. And this is not accurate. In addition, behaviors that are caused by and are due to a student's disability should be treated with interventions and supports and not punishment and discipline. And so if you're in a situation where your student with a disability is being routinely suspended, I do encourage you to take a look on our webinar on school discipline, which has more information about your specific rights in the discipline process. If you're working with a student with a disability, as well as our manifestation determination review guide on our website, because we won't have time to get into a lot of those specifics today. And so within the federal law, the IDEA, there is specific language that states that an IEP team must, in the case of a child whose behavior impedes a child's learning or that of others, consider the use of positive behavior interventions and supports and other strategies to address that behavior. And so we really can't emphasize enough that behavior and social emotional support is part of learning. And for students with IEPs, it's part of what constitutes a free, appropriate public education that they're entitled to. And so behavior supports for students with IEPs, they must be, positive behavior interventions and supports must be considered. The main way that these supports are provided within an IEP is through a functional behavior assessment or behavior intervention plan. There's also the use of behavior paraprofessionals or crisis paraprofessionals for students exhibiting behavioral challenges. And then another thing that we often advocate for within IEPs is for staff to get specialized training and support. And so for IEPs, here are some specific things that you can ask for from the school in order for them to better support your students' needs. You can request assistive technology, sensory items, weighted vests, ask for paraprofessional support, and behavior interventions plans. You can ask for time Excuse me, sorry, jumped ahead. You can ask for and allow for time to consult with providers, teachers, and paraprofessionals. Often, families that we work with, we advocate for, weekly meetings, weekly check-ins with all providers to make sure that behavior supports are being provided. Asking for changes to types of services to meet a student's needs, so changing timing or frequency, doing regular check-ins with a school social worker or guidance counselor. And then, as I mentioned earlier, discussing placement options and investigating different placement options depending on a student's specific needs. Something that we also, really encourage and advocate for quite a bit is for a child's clinical team outside of school. So if they're receiving therapy or medication management at an agency or from a mental health provider out of school, to connect that therapist with the school to help them figure out what types of interventions might work for the student in the school setting. And so let's talk a bit more about functional behavior assessments and behavior intervention plans, because this, as I mentioned, is the primary mechanism that can be used within an individualized education program in order for a student to receive behavior supports in school. And so an FBA is a special education assessment. It's important to note. And it's the process of determining why a student engages in behaviors that impede in learning and how that student's behavior relates to their environment. And so the idea is that first you have to identify a specific behavior. So what behavior needs to change? And then the school should be doing an assessment. They must observe a student's behavior in order to figure out when does the behavior occur, where, how often, for how long, in order to determine what's known as the function of the behavior. And so children behave in certain ways for a reason. We call this the function of the behavior. And it's impossible to address unwanted behavior without first determining the function. And so why is this behavior occurring? Something to remember here is that an FBA is a special education assessment. And so, if you don't want a DOE employee to do an FBA evaluation, you can potentially pay for or request an independent assessment. For independent assessments, there are some insurance providers that might cover the cost of the functional behavior assessment or behavior intervention plan. If the DOE has already done a functional behavior assessment, but you don't agree with the findings, you can always request for the DOE to pay for an independent assessment. And to do this, you would send a letter to the IEP team or to the Committee on Special Education if your student is in a non-public school setting or a charter school. And if the DOE agrees to pay for the independent assessment, you will need to then choose an evaluator and then ask for reimbursement for that evaluation. If the DOE does not agree to pay for that assessment, then they can start an impartial hearing. And if the hearing officer finds that the FBA evaluation the DOE has already done is sufficient, the DOE will not pay for the independent assessment. But if they do find that the evaluation that the DOE did is not sufficient, then the DOE will have to pay and reimburse you for the payment for the independent assessment. I would encourage you to see our training on special education and our guide on special education for more information on independent assessment authorizations. But I know that, often in order to get a quality behavior intervention plan, it's really important to get a quality functional behavior assessment. And that's where it might be worth looking into an independent assessment authorization for an FBA. And so the purpose of the FBA is to gather the data and the information about the behavior. And then once the FBA is done, the team must then use the FBA to create what's called a behavior intervention plan that will prevent and address the behavior to promote positive behavior in a student. And so the BIP must include information about when and how often the behavior happens and how severe it is, specific strategies for stopping the behavior from happening, which could include classroom changes, a new school schedule, et cetera, a safety plan for how to manage the behavior when it does happen, such as calming the student down, removing the student from the classroom, having the child speak with a trusted adult, et cetera. Specific school staff who your child trusts will be designated to work to support your child and will be available to safely work with your child when the behavior occurs. A schedule to mark progress and set future meetings so that you can remain up to date on how well the BIP is working and how to make changes if you feel like they're needed. This is usually about every 8 to 10 weeks. It's really important to note that in order for a BIP to be effective, you need to assess whether all staff who interact with the student are aware of the plan and are fully implementing the plan. And if not, to push for and to ask for staff to receive coaching and implementation support. If even with proper implementation, the student is not progressing under the BIP, then the actual BIP should be amended and changed. Finally, I did want to mention the DOE's PATH pilot program. And so this is for younger students at risk for being classified with or who are classified with an emotional disability classification. And this program provides intensive behavioral and social emotional supports for students. Right now, it's only in 4 districts, District 4, 9, 17, and 27. It's for much younger students. So these are all kindergarten classes. And so the recommendation is made at a Turning 5 IEP meeting. And so if you are, working with, or if your child is entering kindergarten and has significant behavioral challenges and might benefit from this program, I would encourage you to ask your Turning 5 IEP team about this, or to email the PATH program at schools.nyc.gov for more information. Again, the idea behind this pilot is to prevent the referral of students, to more restrictive settings when their needs are primarily behavioral. And so hopefully with more supports and services, they're able to remain in District 1 through 32 schools, through support of a program such as the DOE PATH pilot program. Great. So now I'll turn to some tips and strategies. Again, I just want to give the disclaimer, we're not clinicians, but these are just some tips and strategies that were recommended to us by clinicians, and strategies that have worked with students that we've worked with that are in need of behavior supports. And so I wanted to make sure I go through these strategies so that you have specific things that you can request to be made either part of a student's FBA or BIP or IEP, or even just, as I mentioned earlier, if your student doesn't have an IEP, these are just tips and strategies you can ask to be implemented within the classroom as a type of informal behavior intervention or support. And so just some general behavior management tips, setting clear, consistent, and reasonable expectations, providing choices, being flexible. Kids often get bored, so especially when it comes to reward systems, making sure that there's some flexibility there. Taking the path of least resistance and being kind to yourself, understanding that this is a process, especially with BIP implementation. Often we find, if like after just 1 or 2 weeks, if behaviors are still continuing, sometimes we'll get calls from parents who are saying the school is saying it's not working. These things take time, and it takes time for students to learn and change their behaviors. Some specific behavior management tools, use of a visual daily schedule, asking for cognitive breaks between tasks, asking for movement breaks, requesting verbal or visual cues for directions and staying on task, the use of a behavioral contract, the use of a behavior chart or a reward system for appropriate behavior, consistent use of positive reinforcement, requesting daily teacher feedback to the student and parent. Some common de-escalation strategies, staying calm, giving a choice, encourage the child to use a coping strategy, developing coping strategies, show that you're listening, validate the child's thoughts and feelings. And then at the end of a crisis, there should be time spent debriefing the incident to identify ways to improve. These are some strategies for children with language difficulties, using a visual schedule, using a timer or visual countdown system, using first-then statements, offering choices in a visual format. Strategies for children with attentional difficulties, creating a simple list of instructions, using praise, creating a reward system, using consequences effectively, establishing structure. Strategies for children with low frustration tolerance, completing tasks one at a time, beginning with less complex tasks with fewer components, returning to mastery or a task the child can successfully complete, offering choices, providing scaffolding, encouragement, and praise. Some strategies for highly active children. So movement and motor breaks are key. Asking for a child to be able to use a fidget that's small and silent. Setting clear rules and expectations for behavior. Strategies for children with anxiety. So using coping and calming strategies, listening to music on headphones, deep breathing, or watching a preferred video clip. Promoting the use of active positive coping strategies through modeling, co-participation, and discussion. Engaging in exercise and physical activity, and offering choices. And again, these are all strategies that hopefully, your school's providers and teams should be aware of. But if not, if these haven't been implemented, these are all things that you can ask for to be placed within a BIP, to be placed on a student's IEP, to be implemented, again, as I mentioned, just as a more informal behavior support or intervention, depending on your child's specific individual needs. And so now let's move into some problem solving. So what happens when you are asking for these supports and your child is not receiving them, or if there's pushback from the school? And so what we typically recommend as an escalation path when you are trying to resolve special education or just generally education-related issues with the Department of Education. So we always recommend that you start with the school. Specifically, if your child has an IEP and you're asking for more behavior supports, I would make sure that you reach out to the school-based support team, the school psychologist, school social worker, the folks that typically those that are known as the IEP team within your student's school, to ask them for support in working with your student's classroom teachers, other school staff, when it comes to providing more behavior supports in school. Something we see at times is that there can be a disconnect between the school-based support team and maybe the folks in the administration that are in charge of school discipline, school safety. And so, making sure that, especially if your child has a disability, that your child is being viewed as a child with a disability and not being removed or disciplined for their behavior is something that by connecting the school-based support team and reaching out to them and asking them for more support in lieu of discipline, in lieu of calls to EMS, that can be a very helpful connection to make. If that is not working, and I'm sure a lot of you are here because it's not working, and you have tried to ask the school for support. The next step is to go to the superintendent's office. There used to be borough-wide city offices that had behavior specialists, and that's where the directors of student services and the administrators for special education sat. But now your main point of contact is going to be the superintendent's office, which is where the family support coordinator, the directors of student services, and the administrators of special education sit. And in order to get information on your school superintendent, you can go on the New York City DOE's website and look up, your school's DOE website, and all the superintendent information, the superintendent's email address, the family support coordinator's email address is all available there. I'm sorry about that. And then if that is not working, if you are unable to get support from the superintendent's office, you can then reach out to, if your child has an IEP, to DOE Central, to email specialeducation@schools.nyc.gov or call the special education helpline at 718-935-2007. Again, this is helpful if you're asking for an FBA and then the school is not doing the FBA, or you're not comfortable with the FBA or the behavior intervention plan and you'd like a new assessment. Any issue related to special education that you're not getting a response from the school or their superintendent, we would encourage you to reach out to the special education email address. Some specific things you can ask for, from the folks in either the superintendent's office or the Office of Special Education, or even just the school, is again, asking for an independent assessment authorization for a functional behavior assessment if you feel like the school is just not has not developed a quality functional behavior assessment and behavior intervention plan. Asking for, specific support from the school psychologist, and if the school psychologist is not responsive, asking to speak to the supervising psychologist for your school. These contacts, these are the people in the school setting that should have the training to be able to identify a student's behavioral challenges and identify specific strategies to help address that child's challenges. And so, really trying to bring these people into the conversations that you're having with the school could be really helpful in terms of getting more supports and services. And then there's a link here at the bottom of this slide for with a Google website that lists all of the school and superintendent information and all of the specific school contacts with email addresses. If your child your child is struggling, you're struggling to get in touch with someone from the school or someone from DOE Central, the superintendent's office. Just some general tips, keeping copies of all emails and that you're sending to the school, keeping a list of contacts that you've spoken with, as well as the dates of conversations with school staff, tracking the services that your student is receiving. And so, it's really important because if they're not receiving all of their mandated services, or if there was a delay in services, you might be entitled to compensatory services. So it's important to keep track. It's something we just a general advocacy tip we encourage that we implement. We encourage parents to use is being, politely persistent. And again, if the school is really struggling to figure out how to help, trying to bring in as many people from the outside, reaching out to specialists, encourage, there are behavior specialists that are employed at the DOE, in DOE Central that could come in and provide more support. Trying to get third parties in who maybe can take a more objective look at what is happening in the school and at the student's behavior, and then suggest and recommend specific supports for the school to be using to support your child. And so when to call AFC. So if a school will not recommend any new behavior supports for your child, despite your child needing behavior supports, or if they won't, if they're saying that they won't provide any new behavior supports until the next IEP meeting, or they're sort of refusing to provide more support, that could be a reason to call AFC. If a school is saying it can't consider any changes to an IEP or any additional supports until they conduct evaluations, until there is a meeting, then that's again something that you can call us about, because as I mentioned, schools should be able to provide supports through the evaluation process. There are behavior supports that are available to all students, and so there are ways to advocate for those supports in the interim. If your child is removed from class, suspended from school, or otherwise disciplined because of their behavior, that would be another reason to call IFC. If a school is calling 911 when a child's behavior is not a true emergency, again, another red flag and something that you can call our helpline and we can help you navigate that situation. Great. So we have quite a bit of time left. I didn't realize that we would, but I'm happy to answer any questions as they come up. Let me just see here. So I see, okay. Oh, so I see there's a question here. With the DOE pilot program, would it be expanded anytime soon for District 12? So I'm not aware of, I mean, we certainly hope that it will be expanded. I'm not aware of a specific expansion. It could be something that you can actually ask. I would encourage you to actually just email that email address and say that you would like it in District 12. My understanding is that the DOE is hopefully going to expand it. And so if your child has a specific need and you want them to be able to access it, then it would be good to make sure that they're aware, that District 12 is in need of a PATH program. Great.
I don't see any open questions, Rahini.
I'm sorry. Say that.
There are no more open questions right
No more
now.
questions. Okay. So, you know, we can stop the recording now, and if folks have specific questions, oh, here, there's a question here. Oh, so I see a few more questions coming in. Liliana, it's up to you. We can stop the recording and I can answer these questions live, or keep
Sure.
recording, whatever you prefer.
I'll pause recording now and just let me know. We'll go back to live when you tell me.
All right, well, thank you everyone for joining us. I think we'll launch the final survey right now, so that you can fill out just a quick survey about this presentation, whether it was helpful, if you would like additional information or other information. Just in general, if you need help, please call our helpline. The number is up on the screen, 866-427-6033. We also have an email address, info@advocatesforchildren.org, that is monitored if you have any specific questions or concerns. I understand this training was a very general overview of all the different behavior supports that you could potentially advocate for. But if you have a specific situation that you're trying to navigate, once we close the feedback survey, I'm happy to pause the recording again, and that way I can stay on until 5 to answer any specific questions.